Tuning in to the online broadcast network, AfterBuzz TV. Over 20 million weekly downloads in over 150 countries, and your number one source for after-show entertainment. AfterBuzz TV, the destination for TV superfans. Producing aftershows for over 300 of your favorite TV shows. Interviewing celebrities and showrunners. And bringing you behind-the-scenes exclusives. All thanks to E! Entertainment's Maria Menounos, producer Kevin Undergaro, and internet leader Akamai. Now, let the buzz begin!
Hello, everyone. Welcome to another Spotlight On with me, Ashley Daniels. I am with a really awesome guest tonight. I already have interviewed once before Dr. Paul Nassif, who's actually his partner in crime. But this is Dr. Jaime Schwartz, who specializes in breast augmentation and fixing breasts and making them beautiful. We were debating on what we can call him, maybe the fixer, the boob god. Not really sure. We're going to come up with that later. But
absolutely. In
the meantime, Dr. Schwartz, welcome.
Thank you. Thank you for having me.
You're very welcome. Thank you for coming today. I know you're probably very busy. A lot of people's boobs are being sacrificed right now, so you could be here. So thank you very much.
We did kind of condense some things, and we did kind of run around today.
Okay, fine. Okay.
Anything to be here and see you.
Oh, thank you so much. Now you're making me blush. I made you blush. We got back and forth. All right. There's so many questions that I have, and I'm sure a lot of girls will relate. So we'll get to those questions in a bit. But I just want to know a little bit about your company. You recently opened, congratulations, the Beverly Hills Breast Institute. Can you tell me a little bit about that?
Sure. The Beverly Hills Breast Institute was something that we started in order. We want a place that's a resource for breast surgery for patients that have had good, bad, indifferent things that any questions you have. We want to be a resource for that. I take care of patients that have breast cancer, that have had even just bad breast augmentations, and even things where they have congenital deformities. A lot of people were born and maybe missing a breast or have severe asymmetry, and they're afraid to even, especially in California, afraid to go to the beach or just be outside. So we want to kind of be a resource for that, and rather than just say we're focusing on one thing, or if you don't have cancer or anything, we want to be there for everyone. Is what we're trying to do. So we're trying to be a comprehensive place.
So it really is the place where you go when you want to have your questions answered. Mm-hmm. You want to have time with the doctor. You want to really a lot of people are afraid to even take that first step. So it's kind of like a comfortable environment. Doesn't feel very like hospital-like, I'm guessing.
Absolutely. And actually, one of the things about me is for the American Society of Plastic Surgeons, my national society, I sit on a lot of committees, including our patient safety, our health policy, our patient education committees. And one thing I tell people, when they come to see me, I want to explain everything there is to know about whatever procedure or whatever they're interested in having. Even if they don't use me for their procedures or just want to get information, it's more important as a consumer that you understand everything that's out there, because surgery is not something to take lightly. There are risks with it, so the safety portion is the most important.
That's amazing that you would actually, there's so many doctors that just want to get you in and do the surgery, and you're more about educating the patient as well, so that they make the right decision, so they don't have to come to you with these botched breasts, although you fix them and I'm sure make them very beautiful.
We do, but I also enjoy the long-term relationship. Like for me, it's not just a surgery and move on. It's we're going to see you yearly. We're going to see you 10 years from now. We're going to see you whenever you need us, but also we want to be there for you.
Right. And I want to brag for you for a second. I know you won't brag, but correct me if I'm wrong. Is it 1 in 10? You're out of 10 different plastic surgeons. You were the one of only 10 plastic surgeons in the U.S. to develop guidelines for breast reconstruction using implants and tissue expanders.
So I do a lot of stuff nationally. Like I said, I think the most important thing that people have to understand is education and safety. So I was asked by my national society to develop multiple guidelines for us. One of them was for breast reconstruction with tissue expanders and implants. Another one is actually something using autologous tissue, meaning using your own body for breast reconstruction. And so I do a lot of things where I think safety is important, and we develop these things so that everybody in the country can kind of follow sort of a sort of guideline and at least understand where you are with things. So I think it's important.
Well, so that's using your own fat from maybe other areas as well?
Yep.
And people use that in place of implants at some points, correct?
You can, yeah, you can.
Okay.
We always want to develop the most natural looking and feeling breast as possible, and so if that's possible, it's one thing we do. A lot of times what I do for people is we use a lot of implants and we use fat also to really kind of camouflage things and make things soft, but you can still get an augmentation. So it really depends on, again, that's why the whole point of the center is really to see, really to develop what's right for you.
Now, I heard, I wanted to get my boobs done years ago. I never did, obviously, but I did see a doctor, and I remember him saying, I'm going to get a little graphic, but I remember him saying, you're an easy procedure because he said aesthetically, my breasts were in the right place. Mm-hmm. And so he's like, literally, if you want to know what you're going to look like, it's literally you, just larger. There's no like change in how they're going to look or anything like that. So do you find it that there are some patients that you may think are easier to do because their breasts are already in the right area versus...
You're probably more in the minority than you are in the majority. So yes, when most people come in, they have asymmetry. They have one breast that's larger than the other, one breast that's lower than the other.
That's difficult.
And then you have to, and then they want things more symmetric. That's actually one of the reasons why people come in for breast augmentation. It's not always because they just want to fill out a bathing suit, which is another important aspect of it also. So they don't feel comfortable, being intimate, it's hard.
That is sad. Yeah. That's sad, but you can obviously fix them. So there's light at the end of the tunnel. So also, speaking of, obviously you work with Dr. Nassif. Can you explain a little bit about your partnership with him?
So Dr. Nassif, my medical partner, he obviously...
Yes, medical partner,
medical partner. Oh, actually, yeah. Well, maybe you never know.
Although you guys make a beautiful couple.
We do, and we do spend a lot of time together, so you never... One would question once in a while.
I feel like Dr. Dubrow would get a little jealous of your bromance, though.
They
get a tight little thing
listen,
going.
It is LA. There could be, there's the other, sometimes you substitute once in a while. So with Dr. Nassif, he's a fantastic doctor.
Yes.
And he obviously, his TV show Botched. And part of the reason that he and I get along very well is because of that. We both have a passion for fixing things that have been, bad. And I think that's where we really find our creativity. But also he's a facial plastic surgeon, so he really works from the neck up. I'm a plastic surgeon, so I do work in the entire body, but the truth is, because my background in breast cancer and breast reconstruction, the things that I enjoy doing, I really focus on breast and body procedures, and that's why it's really sort of our perfect specialty thing. So we've almost become sort of super specialists in our areas because of that.
You're obviously not in the same building, though.
We are. Yeah.
Oh, you are in the same building?
Same office, same everything,
okay. So would you ever tackle someone who wanted something done here and then something done here? Would you do the same?
We do. Yeah.
Okay.
As long as it's medically safe and we feel like it's okay, we absolutely do. Yeah, we absolutely. He'll do the nose procedure and I can do a revision breast surgery or something like that. Sometimes, yeah, absolutely. We do that a lot because a lot of people want that. They, everybody says they are the best in every possible surgery. Well, that's not always true, and we see that time and time again. So that's why when you have somebody that's a specialist, he specializes in what he does, I specialize in what I do, and your chance of your better outcomes in the long run are typically better. So
that's very true. A lot of people do want to say they're the jack of all trades, but you can't. It's not as accurate. You just feel like you're in better hands when someone's a specialist. So that's really great that you're able to specialize in something. So also, now you've been working. Is it? I don't know if it's just lately or if it's since. I don't know how long you've been. How long have you been doing plastic surgery in general? Because you look like you're like 21.
I know,
so I'm like,
says
wait.
That to me. I've been in since training. I've probably been at 14, 15 years now with that. And I've been in California, I think, about 7 years now.
That's amazing. And you're from New York.
You're from New York originally, yes.
Okay,
yes.
And so you're a New York guy in Cali. We were talking a little about pizza. You told me about a really great pizza place I can't wait to try. Going off topic. But you've been working with transgender patients. Is this something recent, or has this been for years, but we're just kind of hearing about it more now that it's a little more out in the open?
I've seen them. So I've seen patients that have wanted those type of surgeries before. So to give you a little bit of my background, why I've sort of even probably reached this level in a shorter period of time.
Yes.
So I was recruited out to California to build a breast cancer program for a hospital. So I was chief of plastic surgery at a hospital for many years. So whereas people are kind of trying to find surgeries, I was always operating 300-400 surgeries a year. I mean, I do a lot. I was doing a lot of surgery. people were starting to seek me out then because they were looking for somebody that was becoming a breast specialist, which is how I got into this anyway. Whether it was cancer, or whether they had 20 bad breast surgeries, or whether they were looking for transgender. So I've seen everything.
Right.
And so what you're seeing nowadays, it is becoming a little bit. Probably because of the media and probably because of what's gone on recently, you are seeing it a lot more, and it's becoming a little more accepted. And now, so people are coming in, and now I have some males that do want a breast augmentation. I actually have a female patient who has a possible could have a high probability of breast cancer in the future. So she actually wants her breast removed and become more masculine anyway. So there's a lot of things that are kind of that we look at nowadays.
That is so interesting. And going on to speaking of breast cancer. There's a way to detect now, correct? If your family had it, like there's a certain
There is a gene. There is a BRCA, a breast cancer gene. Yeah.
Do you test for that?
I don't. I typically. So I work with when it comes to breast cancer and those type of things, we work with a team typically. There's breast oncologists or breast surgeons. There's oncologists which do cancer. So I'm part of the team. I'm part of the reconstructive portion of that team.
Okay. And do you see that more people are male or female in the breast cancer? The people that come in that have suffered from breast cancer, or they may be more they have the gene to get breast cancer?
In terms of breast cancer, I mean, most common is obviously female. Breast cancer is actually a very hormonally influenced cancer. So when you've had high fluctuations in estrogen and progesterone throughout your life, you have a higher chance of breast cancer. So mainly it's in women. However, males do get breast cancer, and we have seen that before.
Very interesting.
And especially when you start looking at genetic components, it's not 100%, but you start looking at everybody that's there.
So when you are working with people who may have suffered from breast cancer, you're trying to reconstruct because they had to get them removed, obviously.
Exactly. So there's a lot of people that we see, they're diagnosed with breast cancer, and then like today I saw a few people, they'll come and see me, we'll talk about their reconstructive options before, so hopefully we can do what's called an immediate breast reconstruction, meaning at the time they have the breast removed, then we can start putting an implant or expand or something like that at the same time. I also fix a lot of bad things. So I've had people that have come in, they've already gone through their breast reconstructions, and they're just unhappy. Either one side's too small or high, or whatever it is. And we kind of look at those options also for them.
And now, in terms of placing them, do you do, I remember hearing that you could do it through the belly button, through the armpit, through the nipple, there's all different ways.
Yeah,
what is your specialty, or what do you prefer?
So there's 4 major ways to place a breast implant into a breast. One is through the areola, like you said.
Yes.
One is through the inframammary fold, or underneath the breast crease, through the armpit, and then through the belly button. Typically, I don't do the armpit or the belly button ones too much because I see a lot of complications with that. I see a higher revision rate. So the belly button one, to me, doesn't make much sense. You're actually doing the surgery blind, meaning you're putting a tube in through the belly button and expanding an implant, and that's it. So if I showed you a lot of things that I fixed from that being happened, I won't do that one. The armpit one makes a little bit more sense. However, if you get a bad scar on your armpit in Southern California, you can't wear a bathing suit. People were doing that to try to hide the scar, but the truth is you're not hiding the scar, because if you have a scar on your breast, there's very few people in your life that are ever going to see that.
Exactly. It depends on your job, but
exactly.
we're going to go with...
Well, that is true. That is true.
But yes, you're right.
Yeah, scar on the armpit is one that it tends to heal very well, but I just always tell people if it doesn't, then your issue is you always have to put a scar on the breast to fix things.
Yes.
So, and for me, like I said, when you're doing the procedure, you're a little bit further away from the breast to get it right. So a lot of the revision stuff I see is when that happens. So,
Okay. So myth or fact, you lose a sense in your areola area. You lose feeling if you get it done.
So the way I explain that to people is the safest way to place a breast implant is through the crease underneath here.
Okay.
You're making an incision. You're going directly, usually underneath the muscle. You're avoiding nerves, breast tissue, and it's a little bit easier. You have a little bit more visualization. And I tell people when I do it through underneath there, they either maintain their nipple sensation, or actually people get hypersensitive for a few months after. I haven't had anybody lose sensation doing that. When you go through the areola, because you're cutting through the area where there's nerves and breast tissue and stuff like that, you do have a higher chance of losing, not all, but even becoming a little bit numb after that procedure. So the truth is you can have it happen anyway. You can always lose sensation, but I've just seen over my practice over time that when you have it through the areola, you have a you have a higher chance of losing losing a little bit of nipple sensation there.
So people are really in the safe area when they're working with you, because you will not sacrifice, like you know what areas are the best one. You're not going to say, oh, I'm able to do this just because it's easier or whatever. It's great that you.
Yeah, my conversation with people is just like this. I say this is an easier way of doing it. This is a harder way to do it, and they actually people still choose. But people still choose what they want. What I've seen is people that tend to be younger, under 25, want a breast, are worried about a scar because they think they can hide the scar between the darker areola pigment.
Yes,
they tend to still choose that, even though because they're not really it's that. When you start explaining to them safety, it's not as a big buzzword. When you're 35 and you have children, and you just want to fill out your shirt again, and you start talking about safety, people tend to choose what's a little bit more in the safer side of that.
Right. And of course, I'm older. I'm sure they're worried about like breastfeeding and things like that. Where younger, you just want to look good, I guess, a little more. So what is the youngest that you do? 18, I'm guessing?
So in the U.S., it's supposed to be, you can have a breast augmentation at 18, typically with saline implants. It's supposed to be 22 for silicone implants. However, I do let people that are 18 years old have silicone implants. They have to sign a waiver and stuff like that, but it doesn't make any sense to me why we've divided that up. And it's funny, I was actually speaking in Atlanta at a breast conference, and somebody asked me that same question, and I said, I still don't believe 21 should be the drinking age. So, as you're telling me 22 for silicone breast augmentation doesn't make any sense for me.
Right.
So.
Well, speaking of that, are you specialize in a certain, so for anybody that doesn't know, there's different types of implants. There's saline, silicone, right?
And then there's two types of silicone. The gummy bear, which is actually a silicone implant, but it's what's called the cohesive gel implant. It's a little more firm, a little more thicker.
Okay, and that's your specialty? Is that the one you specialize in?
So they're newer. So the silicone implants were brought back into the U.S., into the market actually in 2006 for cosmetic reasons. They were always on the market for breast cancer, breast reconstruction. Then about 2 years ago, we got approval for the gummy bear or the cohesive gel implant. They've always been in Europe, but they finally came here.
Okay.
So they're a little more complicated to work with. They're what's called an anatomic. I wish I could show you one right now. I want to use my hands to kind of show you, but they're a little more breast shaped, so a little smaller at the top, a little bigger at the bottom. So they're an anatomic implant. So it's a little more difficult to work with, meaning that you have to get it proper. You have to measure people and only use the size that fits. So it's a little bit more difficult to use, so not everybody uses them. So I do teach people kind of my method for using them, and they'll probably develop their own ways of doing it. But I think it's a great implant. So I do think I wish more people would use them.
Now, that's really interesting. Do you specialize in under the muscle? Like, what's the under the muscle, over muscle thing? Do you pick one?
Again, it's kind of more of a safety type thing. So one of the worst complications you can get with a breast implant, a breast augmentation, is something called capsular contracture. And as I say this, people are probably thinking, well, I may even have that. That's when your implant becomes hard and firm and starts kind of rising up. It can even become painful. So there's less chance of that happening when the implant is underneath your pec muscle. That's your muscle on your chest. And I can get into the reasons why, but it's really a safer place. And that's where most implants in the U.S. are placed, unless there's a reason. So. Okay,
wow. Yeah. There's so much that goes into all of that.
There's
That's
a lot,
amazing.
yeah. That's why everybody says, I'm going for breast augmentation. It's never that simple as just a breast augmentation.
And now, doctors don't have a lot of time to talk to patients, so how do you manage to give people that time that you're, and manage to do all these surgeries in 1 week? Like, how do you balance that?
It is a balancing, juggling act, but I think it's important. I think it's very important. I also, I don't let people come in and just say they want surgery that day also. I always have people come back for a second visit. Like I said, it's more of an education thing with us.
Okay.
I also have a team that I work with too, where they can always call us, email us. If people are outside of California, which a lot of people I take care of are, we Skype with them and stuff. So,
oh, wow.
Yeah, we really try to be as interactive as possible and try to be available.
That's amazing. People have heard of you, obviously. If they want to come to you, but they don't want to fly there for the consultation, they can do it on Skype, and then they can come to you once the day for surgery.
Not really, because you can't really. You still need to examine somebody first, and I can't really give medical advice over that. Yeah. But it's just really. But at least, like I said, if we want to be a resource for things and answer some questions, we can. But I won't operate anybody that I've never seen before.
Okay.
Yeah.
Here you go.
Yeah. Next thing we'll be getting like pictures emailed to us. Right. Yeah, show up on Thursday. It'll be great. great.
Can you imagine? What was I thinking? Oh my God, that is funny. You are rare though. A lot of doctors they get a big head and they think, well, I'm at this level where I'll give you 15 minutes, 20 minutes. I've looked on so many real self reviews of doctors, and the biggest thing I see is I felt rushed. I felt, like I was taking his time. I felt like he didn't want to answer my questions. And you probably have to answer the same question 1,000 times a week. So you're very sweet, though. I can tell that people feel very comfortable with you.
We do. A lot of people come in. California is let's say, a competitive market. A lot of plastic surgeons, and a lot of people come in and they say, I've seen 10 other plastic surgeons, and they'll try to name names, and it doesn't even. We treat everybody the same, no matter what, and a lot of people tend to stay with us because they know we care. I mean, we really do. This isn't just a one surgery thing for us. So.
I think his personality is the number one thing that I would look for. Number one, and then after personality, then obviously you want somebody that's pretty good at what they do as well, a reputation, but personality for me would be a make or break point. And
it's funny, actually, I was doing another, I was doing a podcast thing, and I was listening back to what I said, and I didn't even realize it, but, it's really true. And, so they were asking me a question. They said, how do you know? How do you know the doctor's right for you? Because obviously we see there's a lot of good surgery that happens, but we also, from Dr. Nassif's TV show and emails we get from across the country and the world, there's a lot of bad plastic surgery. And I said that. I said, obviously safety and credentials and this and that, but I think the important thing too is that you do feel comfortable with your doctor, because what? It is surgery. Bad things can happen, and it's how you're going to deal with it after is how you're going to get your proper care. And so a lot of people that we do take care of just had surgery with somebody down the block, and they don't want to see them back, and they're worried about it. And it's just that amazes me, because I'm the opposite of that. So it's,
I can totally tell. And also the fact that you are the fixer just means that you are going to take so much pride in making sure that that you do the best job you can. And then people feel like, worst case scenario, if they for some strange reason were like, I went a little big or whatever, they know they're in the right hands. Exactly. Do you advise people to go larger? Some doctors do because of swelling, or do you?
I'm exactly the opposite.
You are.
So
interesting.
I tell people, and I think we're learning this as we look at safety over time. So first of all, I measure everybody. I have precise measurements I use, and I won't go over a certain size. I do exactly what fits your chest wall. That's where I stop with everybody. When people want to go too large, I actually, one of my favorite line sometimes is, there is somebody that's going to operate and it's just not going to be me, because there are some people that really I don't want to be dealing. I don't want to do that. I don't want somebody leaving my office with something that just does not make sense to me, and I don't feel comfortable with also. So I think measurements are the most important things in finding an implant that fits. And then the other thing too is, most people I take care of are professional. They're lawyers, they're doctors, they're doing stuff. You don't need a big implant. And you know what? I tell them, if you find someone that's going to fill out a shirt for you when you're working, you want to go out on Saturday night and have fun, put on a push-up bra then, put on a padded bra. Nobody's going to know the difference, but it's not going to inhibit you, and it's not going to cause you problems down the road. So, gosh,
I wish more doctors were like that. I don't think we'd see as many problems. I mean, it's amazing that you don't just, a lot of doctors just take people because they're like, well, it's another patient. It's another check. Let's bring it in. We'll do what you want. And you're and in that sense, you don't have that Hollywood thing about you where you're like, oh yeah, I'll make your boobs huge. You want your boobs huge. You're like realistic, and you're an artist. It seems like you sculpt people as if it's a piece of art in a sense. You take so much pride in it.
When you see, especially when somebody comes and they have something that's happened that's really bad, and you have to envision and put it back together, that's when it becomes sort of fun, and that's when it's
Yes, that would be, oh my gosh, just to be a fly in the wall. I mean, not to be like perverted, like, but I just mean to see like what you do before and after. It's amazing. So what else are you, so you specialize obviously in restorative, aesthetic, and corrective breast surgery. What else would you say is your passion in terms of, like, do you like to educate people? It seems like you do a lot of speaking. Expand on that.
I do, and I speak for a lot of breast stuff, but actually the truth is I do all restorative surgery. I do. We've seen bad tummy tucks. We've seen things fall apart. I've seen sort of everything. So there's people once they start knowing that you want to fix things, like you kind of become the person they send it to. So we've had tummy tucks that haven't gone well. We've had everything that's kind of not, and we sort of fix all those things. So
I've seen a lot of bad, what's it called? When you take fat out of people with the needle.
Like liposuction.
Liposuction, where they get all like cottage cheese looking.
Yeah.
What is up with that?
And that's when people are actually, it's funny you say that. I see a lot of that too. We do. Yeah, we see liposuction. People have sometimes. I don't know if they're unrealistic, but a lot of people think they have fat and they really don't. And so, and then they always say to their doctor, I have fat, and somebody's going to say, well, I'll operate on you, we'll get it all out. And then you start seeing those issues. When you do liposuction, you really have to think about it as a body contouring. Your goal, you can't bring your waist down to here. It's just bringing in a few inches to kind of curve things out for you. So you want to be, again, conservative when you do all these things. And I think that's because once you have an issue, it's really hard to fix. So
right, you're better off going little by little. Maybe if you wanted more after, you go back for a second time. But why is some of the people are growing fat in other areas? Once you take the fat away, it can never grow back in that area, correct?
That's not, everyone says it's not necessarily true.
Okay.
So you do fat our cells and you take them out and put them in other, so we take them out and put them in other places in the body. So we'll take them out, from the, let's say the stomach area, and we'll put them in the butt area. A lot of people want this Brazilian butt lift now.
Right.
We do that.
I heard about that.
I do that. I do, breast augmentation with fat.
You do
we do exactly. We do a lot of those things. So when you take fat cells out, they're not going to grow in your stomach anymore, but there's still fat cells that are there. So it's not like it's never going to grow there again.
Oh, okay.
Yeah. So I think that is a little bit of a myth in terms of things. So.
What do you see in terms of butts? Because people are so obsessed with the Kim Kardashian and the J-Lo butts.
Yes.
Do you do fillers in the butt now? Is that what I've been hearing?
So,
not you, but
fat grafting.
Yeah,
yes, it is fat grafting. There was a trend towards butt implants where people are doing gluteal implants. There's a huge complication rate with them. So I think most people have kind of backed off them and really? we really just do fat grafting, which is one of my favorite procedures to do. I think it's a really nice natural look. It's when you take in the back, especially the love handles, take that in and put it lower, it really kind of curves things back there.
Wow.
So it's really nice.
Oh, that's great.
Yes, I think it's great. And I have tried the fillers actually.
Have you?
Yeah, I have some really thin patients that are doing a photo shoot or doing a video, and so we want to fill things up a little bit. I've tried it. It becomes prohibitively expensive. I
can only imagine how many you would need to fill just one sheet.
Like I said, we've done it, so
my God.
We won't fill the whole thing, but we can touch up some areas for you. But yeah, it's not the right. And again, I tried talking them out of it, but it's the problem is all her friends were going to Miami to go to one of these pump parties where they go to like a hotel room. There's not a doctor there, and they inject silicone in, and we've seen people die with that. So at least this was a trade-off of things.
Yeah. Now, do you do fillers for like Botox and stuff?
Yeah.
So you do. That's nothing to you. I'm sure. It's easy,
I do
it's
all
not
the things. I do fillers, Botox, regular plastic surgery.
Okay. Cool.
But people don't seek me out for that. They seek me out when they have really bad issues, and we fix all that stuff.
Right, of course. So, but if they want to just get a little bit of a little Botox here and there while they're there, they can do that too.
I've found. once you fix somebody, especially once you've done their big major surgery and put everything back together for them. They become my Botox patient. They trust me with all their stuff, and I'm pretty conservative with those things also. So,
honestly, I just by talking to you the first 5 minutes, I knew if I were to ever do anything, I would go to you in a second. Honestly. Right, and then Nassif for neck up.
Yeah, exactly.
I just do it all once.
We'll divide.
You are so cool. So quickly, I wanted to. There were a couple questions that were just asked, and I wanted to. A couple girls here at AfterBuzz were wondering, in terms of reduction, do you do reductions?
I do breast
as well?
Yeah.
And what are there complications in that? Like, if it's not somebody that already has implants, they just naturally are lucky, as I would say.
Yes.
But how do you do that?
Well, they don't consider themselves lucky. They consider themselves so large that they have back pain and neck pain and shoulder pain, and it's actually, it can inhibit you from even working out and doing things you want to do. So it's not always, there's too large and too small. There's always an in-between. So I do breast reductions. Complications are kind of similar to other things. You're removing breast tissue. So if you always think about the nipple and areola in terms of, breast sensation and breastfeeding and things. So right now your nipple and areola are getting blood supply and nerve supply from all the breast tissue there. If you remove some, then you have to start worrying about losing, nipple. You have to start worrying about losing nipple sensation or blood supply and having things, necrose. And so so even when you do that procedure, you can't take somebody from a double D to a B. It's just not. It's too much. But you can make them a large C and really the truth is it's not even that. It's really proportionate. You have to make them proportionate for what fits their body. So, and that's kind of same thing. We do that. Conservative, great procedure. Actually, I love doing breast reductions.
Do you?
Yeah, it's
cool.
It makes people really breast surgery across the board, reductions, augmentations, lifts, all those things. It's one of the highest satisfaction rates in all your patients, and they're just so happy after it.
Yeah.
It's just
boobs make people happy.
They do.
Boobs equal happiness.
Guys and girls. Yeah.
Everybody. Boobs make everyone happy. Anything else that you wanted to share today? Because I mean, geez, you're like, you're amazing. You do everything, but I don't know if I covered everything. I want to make sure.
Yeah, I think we did.
What's your website? People can learn more. Maybe do you have any pictures on there, like before and after?
We do. We're actually launching a new website in the next week or two.
Oh, wonderful.
Hopefully it'll, because that'll be our our website is actually going to start trying to focus more on patients than me. I don't need to be the star. Everybody has a website that's the star. I don't even have my name as our website. It's BeverlyHillsBreastInstitute.com.
You should, though. You're so awesome.
I'm on there, but it's really, again, it's really supposed to be a resource. So we actually did something really cool recently where we had our patients come to our Rodeo Drive office, and we had our patients come there, and we did a photo shoot with them in regular clothes, like breast cancer patients and cosmetic, and just all together, just having fun, and just to kind of show what we try to do. And you eventually, once everything gets up, you'll see their stories on there and how they went through. I think one of them was 19 years old, and she had both her breasts removed, and I did a breast reconstruction for her. So, I mean, there's interesting stories that we have on there. You can see a lot of things.
Videos, or is it more of a story, like your blog?
These will be sort of blog-type things.
Wonderful.
We probably are going to start. We'll probably start doing more video things as we move on with this, because it became... It sort of just started, it just went that direction, and the patients had fun with it. So now we're like, whatever they want to do, we're happy to kind of oblige. So,
that's awesome. Yeah, and you feel a little more trusting when you see somebody else went through something, and you can kind of see, like, you can compare your body. Oh, my body's kind of like that, and look how she came out.
Exactly.
You know, so that's awesome. What is your website name? Are you going to change it, or is it going to be the same?
No, it's BeverlyHillsBreastInstitute.com.
Okay.
Yeah, it'll just be a newer version launched pretty soon, which will be a little nicer and probably more what we're looking towards. But yeah, that's what it is.
Where can people ask you questions? Are you on, like, Real Self or like anything like that?
We're on Real Self. We're on Facebook. We're on Twitter. I think we're on like everything. Everything, because we want to be available. I mean, the best thing is honestly the website. Call us, send us an email. We will get back to you. I mean, it's
awesome.
Really
That's so rare.
We go through these things a lot. I have a nurse practitioner who I work with every single day. We're side by side. We constantly review these things. So
That's
we want
awesome.
we want to be there for people.
Wow.
So.
And we'll put the links to your Facebook and everything. Do you know your Instagram or your?
What's my Instagram?
We can post it too.
Dr. Jaime Schwartz.
Dr. Jaime Schwartz on Instagram.
That's my Instagram.
Easy.
Yeah.
I like it. I have to have 100 different links because my name's so common. Ashley Daniels. I'm like Miss Ashley Daniels on here, but great. Okay, so I'll also post them on the link too.
I'm better with the surgery than with social media,
that's
so
okay.
that's probably
we all have our specialties.
Yeah, that's why I have to ask these things.
I love it. No, it's so cute. I love it. That's awesome. Well, you are so awesome. I really enjoyed talking to you, and you have such a great aura about you. I can see why so many people feel so safe with you. And anybody that has any questions, as Dr. Schwartz said, you can email, go to his website, and you can Instagram him at Dr. Jaime Schwartz. And thank you so much.
Great, my
You're
pleasure.
Awesome.
Thank you for having me.
And I'm Ashley Daniels. You can find me on Twitter at Ashley Daniels, Instagram Miss Ashley Daniels, Periscope Ashley Daniels. We'll be going on Periscope in a few minutes. Dr. Schwartz, we're going to break his Periscope cherry, so we're going to do that. And thank you so much. We'll see you next time. Bye.
From executive producers Maria Menounos, Kevin Undergaro, Phil Svitek, and the entire AfterBuzz TV staff, we would like to thank you for listening to the AfterBuzz TV network. To watch or listen to other after shows and post comments or questions, be sure to visit AfterBuzzTV.com. I'm Sir Richard Wentworth, and this has been a presentation of AfterBuzz TV.
The views expressed herein are those of the hosts only and do not necessarily reflect the views of AfterBuzz TV or its owners or principals.